spinal stimulation. This is really a minimally invasive way to cure different types of severe chronic pain. Now there's lots of different conditions that can require the need of a stimulator. Chronic pain coming from the spine, there's different types of pain coming from people who have failed surgery. We call it failed back surgery syndrome or post-laminectomy syndrome. Patients may be in severe pain even despite surgery for many years, and those patients can get fantastic relief with this treatment. The other treatment that this can be useful for is intractable migraines, basically severe headaches. This can be a successful treatment for those patients as well. The other treatment that it can be useful for is inoperable peripheral arterial disease. There's a condition called complex regional pain syndrome, which can be a very miserable source of pain in an extremity, and that can be treated very well with this condition. So it can be helpful for lower extremity pain, it can be helpful for upper extremity pain, and even neck and back pain. First, we get approval for a trial. It's performed commonly in our office, and what we do is it's done like an epidural injection, and we are able to put in a tiny electrode inside the epidural space within the spine, and it's a very safe, relatively painless procedure that once the electrode is placed where it needs to be, we can stimulate the electrode, and that stimulates the spine and can literally turn off the pain. It replaces the pain with a very pleasant tingling sensation, and it can be dramatic in how someone who's been suffering from chronic pain for many years can have their pain turned off just like that. And what happens is that the patient first goes home with this device, so it's like a trial, it's like a test drive. Like if they are buying a car, for instance, you kind of test drive it, so you try it out at home for a few days. This is a device that's kind of like tailored, the programming for the pain relief is tailored to the patient. So at the same time, there's not only are there different programs to relieve the pain and depending on where the pain is and how intense it is, but also they can adjust the level of the stimulation so they can get more or less depending on their needs. And the battery itself is actually a rechargeable battery. It can be charged through the skin. There's also the option of having a non-rechargeable battery that just lasts for several years. When we know that it's going to work, we know where the leads need to be placed. We really, at that point, it's all put underneath the skin, and to do that, we just make a small incision in the side or the flank where the small battery will be placed, and then there's also one right in the middle of the spine. We follow our patients very closely. After it's implanted, we have them come into the office within a few days to a week, and then we'll see them for a couple weeks after that, and then a month later, and then a few months after that, and then up to a period of 1 year, we really watch them, and we make sure that if there's any situation, we know about it right away so we can take care of it and make sure that their pain is under control. It's stitched in place with lots of small stitches or sutures. We basically tie it to the tissues, the firm tissues of the body below the, at the level of the muscles so that they won't move. Even though these procedures are really medical breakthroughs, they're all cutting edge, they're very innovative procedures. None of the procedures that we offer is experimental. There's nothing that we do that is beyond the standard of medical care, and we practice accordingly. That's why everything that we do is covered by insurance. It's a very safe procedure. In our hands, the complication rates are extremely low. We have very high performance, state-of-the-art equipment that really allows us to see a very fine level of detail in placing these. So we know we can do them very safely. And without as much difficulty as can occur in a place where the equipment is not as fine. And number two, the risks are still very low. There's definitely a risk of infection. We actually do give antibiotics routinely to prevent that. There's a risk that you can have a spinal headache afterwards. Again, if that happens, it's usually a temporary thing. We can usually treat that conservatively. And then one of the other things that can happen is over time the leads can migrate. Again, relatively unusual for that to happen. We do a really nice job of setting it where it needs to be, and it tends to stay there. There are some limitations afterwards. For the first month, we ask that people not perform certain activities that can cause it to migrate. But after that period of time is over, people can live a normal life. I mean, people who are in just severe pain, who are just feeling like there's really no hope, this can offer some hope. This can offer a way for patients to get their life back. It can really restore the quality of life of someone who's been miserable.